Hello, I'm Dr. Frances Pitsillis, and today I'm going to talk to you about the serious problem of fatigue. It's very common. Many people that you know tell you that they're tired, and it's a serious complaint, and often we worry about it and have difficulty helping people with this problem. Now, the approach to fatigue is multifaceted, and I think the first approach has got to be looking at your lifestyle. Are you getting enough sleep at the right time? Are you in bed and asleep by 10:30? Because the body likes that a lot better. Shift workers get more tired. Are you drinking too much alcohol? Are you working too hard? Are you smoking? Do you have a good diet? Are you being burnt out from too much work? Are you stressed at work? Are you getting enough exercise? Because exercise energizes you. Other social stresses can include bullying at work, debt that's too large, marital problems. Have a look around you and assess your situation and start tackling these things. Now, another important area is medications. If you're on medication for hypertension, that can sometimes cause fatigue, in particular the beta blocker drugs like metoprolol, atenolol, celiprolol. Anything with an ol on the end is a beta blocker drug, and that can make you tired. Another common medication is used for cholesterol, and that's a statin drug. Is the statin drug that you're on making you tired? And you can discuss that with your doctor, and if you really have to stay on it, perhaps you can look at keeping the dose down to a minimum, and you can even try taking coenzyme Q10, which helps with energy. Now, in addition to that, sleeping pills and antidepressants can also cause fatigue. Now, one of the things that you can do is ask your doctor if there are any tests that you can have to help rule out anything serious. But before even serious things are looked at, simple deficiencies like magnesium, vitamin B12, have you got a slow thyroid, have you got low iron? When we look at iron, women in the reproductive age group are the biggest group, as well as small children, for having an iron deficiency. If you've noticed that you're getting leg cramp, ringing in the ears, or twitchy eyes, that could be a magnesium deficiency, and magnesium helps you sleep as well. Now, what's also important is that the vitamin B12 test is not really reliable. So if you're at the bottom end of the normal range, it's still worth discussing with your doctor whether it's worth a try of some vitamin B12 therapy. Now, a very big and important thing to test, which is often not tested, is vitamin D. Believe it or not, it helps virtually everything. Sleep, energy, heart, brain, virtually everything. And if you've got an indoor job or you live in an area that doesn't get a lot of sunshine, because vitamin D is from sunshine, then you ought to have your vitamin D tested and correct it if it's a problem. Another area is thyroid. The thyroid tests are often unreliable as well. It's more common in women, especially after menopause. Now, I can explain all this in another video in great detail, but one of the most important things about thyroid is to look for any symptoms. And if the blood tests don't marry up with your symptoms of an underactive thyroid, which you can easily look up on the internet, then you should talk to your doctor about a trial of treatment. It doesn't hurt. Now, a surprising cause of fatigue are food intolerances. Now, believe it or not, I think that most people should avoid eating gluten. This is in wheat, baking, pizza, bread, etc., cakes. Now, we didn't develop with gluten in our diet from Paleolithic times, caveman times, so eventually most of us will end up not coping very well with the gluten. And then selected people should look at milk, yogurt and ice cream, the dairy. people don't think about having a food intolerance because the effect of a food intolerance is that it can be delayed by 2 to 4 days. So that's something that you can think about. Are you chemically poisoned? That can cause fatigue. Always consider this and talk to your doctor about it. If you've worked in industry, if you've been associated with heavy metals like lead, mercury, cadmium, are you working in factories where chemicals are being used? Are you working in a dental environment where mercury perhaps isn't used as much these days, but you're removing the mercury? So that could be important. Now, coming up to the last bits, you're going to go to your doctor anyway because your doctor's got to do these blood tests, but also what's important is your doctor needs to rule out serious causes of fatigue. Whether you've got some sort of infection, heart disease, a neurological disease, an autoimmune disease, this is where your doctor comes in very handy. And all of those need to be ruled out. Don't just put up with this. And finally, the common long-term causes of fatigue that we talk about are going to be covered in other videos, and these include chronic fatigue syndrome, fibromyalgia syndrome, and chemical sensitivity syndrome. These can be fatigue-related conditions where people don't find anything wrong with you, and yet the person is still fatigued and suffering.